Welcome to the Patient Conversion Podcast, where we talk about the business of running independent and PE-backed medical practices. We interview doctors, practice managers, and industry experts to bring you insights that help you grow your practice, streamline your operations, and provide the best care while staying financially healthy. Enjoy today's show.
Excellent. Well, Jeff, welcome to our podcast. Super grateful to have you and excited to learn from you today and to get to know you better.
Yeah, happy to be here. I'm intrigued by the topic and certainly intrigued by the format you put together.
Love it. So let's start by just your background. Tell folks, who is Jeff and what is your background and what are you doing now? And then we'll kind of jump into some specific questions I have for you.
Yeah, happy to do it. I'll try and skip over fairly fast my 10 years in the wine business. It certainly was something that people will say, well, why did you leave that? But I got into healthcare probably close to 25 or 30 years ago and really have spent most of my time what I would call on the provider side. The provider side means working at practices, really running the operations of practices. Admittedly, I started in the dental business and spent a good portion of my time, a little bit on the manufacturing side, but I was the leader of a dental DSO before they were sort of in vogue. I spent a little bit of time on the payer side, which was, certainly an experience that alienated me from a lot of my physician friends, sort of the dark side. And then I spent my last two jobs, I think, are the most salient to this discussion. One was the CEO of a ocular platform that was owned by a private equity firm and then sold to a second private equity firm. And then on that exit, I had an opportunity to go work for Modernizing Medicine, which is one of the leading EMRs in the specialty space. We are in, essentially every specialty except for behavioral health, dental, oncology, and cardiology. So think of every other specialty. We're in the private practice space, not competing as much with Epic and the big hospital systems, but more the ones that are driven by the private practice. And so my role, in all fairness, is a new role for the company. And essentially, my job is to do three things: to communicate with private equity sponsors, those that are buying practices and that are thinking about what's the next move. I spend a lot of time interacting with the CEOs of large PPMs, physician practice management organizations, MSOs. And then I spend time internally with our team trying to ensure that the messages and the narratives that we're delivering to our end user, our customers, is consistent with how they're thinking. So, like, I'm a customer. I was a customer while I worked for Modernizing Medicine. I think I'm bringing that lens. So, it's been a long, illustrious career. I'll end that segment by telling you this is a great job because it takes 35 years of healthcare experience, and it allows me to share that within an organization, and I think for a really great product.
That's really cool. So where did you primarily start working in the private equity world? Where was that along the journey? And just kind of speak into your connection and background with private equity.
Yeah. So if you go back to my time running a dental service organization, we were funded by private equity junior varsity. This is really angel investors and folks that had a vision back in the late 90s around how DSOs would work. And that was really a first time glimpse for me into how investors influence the operations of a business, what it looks like when they buy it, what it looks like when they sell it. I spent time between that role and the role as the CEO. I was president of that organization. And then when I became CEO, that really was the full body into the deep end of the pool relative to private equity. A smaller mid-market firm had purchased a couple practices in Chicago, and the goal really was to roll them up, grow the business, and sort of follow the PPM handbook, which I think is worthy of probably at least 4 or 5 minutes around what that handbook looks like. But that was a purchase with the intention to exit. And then we were fortunate enough to have a secondary buyer come in and look at our business and think that it was a good fit for rolling into a much larger organization. So that
And what kind of
immersion,
healthcare practice
yeah,
was that?
yeah, ophthalmology. So we
Okay.
were an ophthalmology platform with some medical optometry
Okay.
associated with it. But I think if you step back, it's really sort of the classic model: smaller private equity, roll it, grow it, get bought on a second turn, and sort of see how it goes. So I think there's probably a lot of merit to think about, that big question, which is private equity good for healthcare?
Hmm.
Um, that's 3 hours of a podcast, but I think it's probably
Yeah.
worth thinking about a little bit, and depending on what lens you view that, you have an opportunity to look at the pros and the cons. And now, in the role that I have now, I'm frankly seeing a much wider swath of investment,
Hmm.
what's good, what's not, and why it makes sense or why it just could be the worst thing you ever consider.
I actually think a lot of my questions are going to allow you to unpack some of the pros and the cons and the challenges and the benefits. In fact, that's really kind of my first question for you is what are some of the benefits practices see when partnering with private equity firms? And I think it would be great to go past the initial exit for the physician owner, right? It's like that's an obvious benefit. Like they get to take some chips off the table for their years of hard work. But when you think about when you think past the kind of financial benefit of partnering with private equity, what are some of the benefits that you see when a practice chooses to go down that path?
Yeah, I mean, it's the fair and operative question, and I think I'm going to answer it by saying that I'll give you what the picture is supposed to look like, and I'll caveat it by telling you that the picture doesn't always look like what it's supposed to look like.
Hmm.
In other words, there's a bit of a story there that makes it look very glamorous, and in some cases, I think that's accurate. In some cases, the picture is exactly how it's been described.
Hmm.
And then in other cases, it's not even remotely close. Maybe said differently, this kind of transaction is not right for everybody. So to your specific question, the question is, what's in it for the docs? Let's not dismiss the economic value. You mentioned it. And while I know we want to get to other components, the economic value is more than just a paycheck and more than just a liquidity event. It really is an alternative. Well, let me say it differently. It's the only alternative that many physicians have, having built a business for many years. So you've built this business. What do you do when you retire? You sell it to private equity, you sell it to the devil you know, which is the hospital, or you transition it to somebody who is a new up and coming physician and you work out some form of equity transfer. The options are not great. And so I think if you've spent a lot of time as a physician building a business, creating loyal patients, doing what you love, and somebody comes to you and says, look, we want to monetize that effort, I think it gets you sitting up in your chair and thinking. But let's talk about the other things. Let's talk about the other non-financial pieces. I think they're probably revolve around two or three concepts. One is growth. So you have a practice, you're 5 physicians, 10 physicians, or whatever the number is, but you want to grow. And the reason you want to grow is because you can see more patients, you can leverage your size and scale for better costs, you can really get a bigger footprint in the market, but you need capital to do that. So private equity is a great source of capital. They bring the ability to fund certain adventures. not adventures, but ventures,
Right.
certain ventures. Sometimes it is an adventure.
Yeah, that's right.
Yeah, right. But I think that venture is ancillary items. It's a MRI. It's a new laser. It's a ambulatory surgery center. It's some type of ancillary effort, or it is taking on another physician, or taking on another practice, or remodeling. It's things that need capital infusion. And in the world that you live in today, that's a personal check or a personal guarantee from a physician. So private equity has a vested interest in actually seeing you grow. And because of that, they're willing to make an investment. So that's sort of one. It's financial, but it's not as much the doctor
Sure.
seeing a
That's right.
paycheck.
Yep.
I think the second one that comes to mind is there is this notion that there is a professional management component that can be brought by private equity. So, in simple terms, a lot of times you see physicians that have run practices for many years and they have a great staff. And the argument is that that staff is maybe not doing all the things to drive the business. And professional management can be injected into that situation to really maximize your opportunity. Um, I want to pause for a moment and tell you that both of the things that I'm telling you have two sides of the coin. This is that notion of it may not be right for everybody, and the picture that's painted isn't always what happens.
Right.
So in finer terms, you bring in professional management. That's supposed to be better. Sometimes it isn't. Sometimes it's actually worse. I think the third thing that I would say to you is that you do get a different level of community and a different level of guidance from a very different lens. So these are people that are looking at a broader scope of businesses, and I think what they provide, is a view that you may not have. I think that's an intangible, but those are the three things that come to mind. And I'd say again, some are absolutely true and they happen, and sometimes they don't.
Yeah.
We can get into the process, but let's pause there and see where we want to take it.
Yeah, no, I think that's really good. I mean, I think it segues into my next question perfectly. And so put yourself in the physicians. So you've talked about some of the benefits, right, of partnering with private equity, or some of the potential benefits. If you put yourself in the shoes of a physician or a group of physicians who decide, you know what, we're going to go down the private equity path, what are some things that they should be looking for in a private equity partner? And I'll ask this again here in a moment in case you forget it. But my follow-up to that is, not only what do they look for, but then how do they verify it's actually true? I only have one experience with private equity, and it was a couple of years ago, and all the dates, right? All the phone calls, all the dinners, all the conversations were amazing. Like, you felt like, wow, we're cut out of the same cloth. Man, this is the ticket. Wow, they're just going to let us leave us alone. And you even ask some people they've worked with, they say the same thing. You feel like you could go have a beer together and a meal together and enjoy it as much as talking about business. You feel like everything's right. You get in, and within 6 months, it's an absolute disaster. People are being let go of. Things are, what they said the vision was changes just miraculously within 6 months. It's just a dumpster fire. And so I'd love for you to kind of talk through your experience there, and what advice you would have. So I guess my first question is, what should the physicians look for in a PE partner? And then second question to that would be, how do you actually really know, if they're the right partner, so that you're not kind of duped, which again, it's just one experience for one person. But what would you say to that? So those are my next two questions for you.
Yeah, super insightful comment. Let's tackle the first one. I think the first thing you should do is you step back and say, what's the process by which you are going to think about a private equity sponsor? And I think this is a really important point to focus on. There's nothing wrong with looking. there's nothing wrong with determining if this is a good fit for you. But to do that, you really should think about, how do I clean up my operation? How do I assess where I am? If one doc wakes up one day and says, I think we should sell to private equity, I think that's a sort of a slippery slope. I think what makes most sense is the group of physicians to say, let's look at who we are. What's our vision? What do we think long term? Are we well managed? Do we have a handle on our business? What's the succession plan look like today?
Mm.
What do we think our market position is? What's our reputation in the market? What's our technology look like? I think that process helps you begin to think about, is this a right fit? And as you think about is the right fit, you start to get into, what do I really want from this sponsor, this private equity person, this company? I think that informs you much more. It makes what I'll call this sort of reverse diligence process much more realistic. Reverse diligence is this idea of, how do I know? What should I ask them? How can I be sure that this is the right fit? Knowing where you are, knowing what your culture is, knowing what your business looks like, is the building blocks of that kind of question. So let me now transition a little bit into this idea that, like a lot of things in life, you never really know.
Yeah.
You described a good scenario. We did all the due diligence. We asked a bunch of people. This is the best analogy is a marriage. Nobody gets married with the intention to get divorced. I think the notion here is, let's do as much research as we possibly can. If I'm researching under the lens of, this is who I am, this is what we're good at, this is what we want to be, I think that always gives you a much more informed answer. So when I get to the point where I've done a cleanup, I've done an assessment, I've gotten into some LOIs, I now know who I am a lot better. And the questions that I ask the potential suitor are much more relevant to who I am versus, in general, how did it go? The thing that I guess I would say to you is, this is a two-way street. And so sometimes when things go south and they're not nearly as smooth and as the painting is different than what I thought it would be, it's because you didn't manage your expectations properly. It's because you didn't really know who you were. You didn't have a good sense of what they were going to bring. And you sort of went in hoping that it would be all this panacea. I think the balanced approach tends to create a much better short and long-term transaction. That said, make no mistake about it, there's a lot of people that are blinded by a big paycheck.
Right.
I want to give you an example, and I think this is a mechanics component that is critical. So what happens is, you get a check when you exit. Sometimes that check is let me say it differently. Sometimes the amount is all cash, but most of the times it's cash and what they call rollover equity. It's the ability to take your shares into the next organization. So that's a check. That's money. As soon as that happens, there is often a reduction in your compensation. And when that reduction in compensation happens, you can't forget that you got a check. But sometimes that glow of the dollar, the exit, makes you think, oh, this is great. All of the things that happen need to be viewed with a balanced lens. There's a put and there is take, put and a take. I think when you look at it from that perspective, you have a different level of expectation. You have a different level of partnership with your owners. The last thing I'll say, and I hopefully that sort of packages your question, but the last thing I'll say is, Look, this is a chemistry play as much as it is a financial play. Your new owners are going to ask you questions that you hadn't been asking yourself. If you had been asking yourself, you're going to be much more adept at answering those questions. You're going to be much clearer on where the status of the business is. If you've never asked yourself what your AR is, if you've never asked yourself how many new patients you have in a month, if you've never asked yourself what your reimbursement rate trends are, you're probably in for a bit of a shock. And recognize that they are in the business to grow you, to make you more profitable, to ultimately turn that to another buyer. Let me
Right.
take a breath there and see if that packages the story in the right
Yeah,
way.
no, it's really good. I can picture a lot of the groups who don't ask those critical questions of themselves ahead of time being insulted and offended when the private equity company calls their baby ugly, right? It's they were not prepared for, all of the due diligence and the hard questions, and that this is really good, but this is really challenging. And so I like what you're saying in terms of, even going back to what you said earlier about, like, what do we really want? What's our vision here? And then making sure
That's
the
right.
expectations are aligned with that vision, would go a long ways. And then I love what you just said about asking all the critical questions. We love to mystery shop, practices, and we encourage doctors and practice managers to mystery shop their own practice so they actually believe our results. And they don't, a lot of times they don't want to do that. They tend to think their performance is much, much higher than it is. And so I can see that lack of real clarity about what is real and what is not also impacting a private equity relationship.
You're making an interesting point, and I think the picture you're painting is hitting on the reality of a practice. And I've lived in this practice. What Pat at the front desk knows is different than what Jeremy knows in the back room, is different than what Dr. Smith is actually articulating to patients. So this is hitting on a critical part of what makes for a good transaction, and that is communication.
Hmm.
If on Friday, you are owned by the group of physicians, and on Monday, you're owned by a private equity sponsor, and the staff has no idea, I'm going to tell you that's going to be a pretty tough transition. So the reality is getting the right message, managing the communication is as big a part as anything to hope for success down the road. When that doesn't happen, I assure you there's a bumpy road that may
Hmm.
last a lot longer than you had hoped.
Yeah, that's good. Um, I would think that the most important part of any practice is its people, its culture. It has a tremendous impact, I would assume, on patient experience, on quality of life, even for the employees, like showing up to work every day and working at a place they love with people they love. And so the people and the culture component of a practice is really critical, has a really critical impact on every level of the business. What can groups do when they're working with private equity or they go through a private equity transaction? What can they do to maintain that culture and to protect that culture? And I don't want to say necessarily control, but to some degree maintain a certain level of control or independence over the people component and the culture component.
Mhm. We didn't rehearse this, but that is such an incredibly critical question. I'm admitting openly that I've got a little bit of PTSD when you ask that,
Hmm.
because culture and who's leading and how transparent you are and how you show people that you care is really the lifeblood of delivering healthcare in today's world. Uh, My
Yeah,
opinion, and I think really
sure.
good physicians would share that. So when you have that DNA at your practice, I think maintaining that is the responsibility of the leadership that you have at the time of the transaction. And let's be fair, that leadership is usually physician driven. So Dr. Smith does the deal, or Dr. Smith and his 10 partners do the deal, ensuring that the people that built that culture and ensuring that their messages and their connection with employees is maintained, in many cases should fall on the shoulders of the physicians and the lead administrators. How do you do that? I think this is one of those really good examples of being upfront when you're in a discussion with a sponsor, saying, look, this is what's important to us. Here's how we want to maintain that. If that's a surprise 6 weeks after the transaction, you don't have much chance for success. Those physicians built the culture at the business for years, and that has to be part of the story. I will tell you that it's not hugely uncommon to have that written into some of the legal documents. How are we going to maintain that? Look, we do a practice picnic every year, and we do a health walk, or we contribute to this charity. That's part of who we are. It's what we stand for in the community. I think it's very fair to put that out in front and have that even contracted so that those types of components are maintained. I'll go a step further. The idea that I have employees that I want and employees that I don't want, let that be known that you want to be involved with that discussion. You know, what's worse than having somebody who doesn't know your 15-year employee come in and say, yeah, you're probably not the right fit. Like, that's the kind of thing that will just tank culture in a day. And before you know it, that employee isn't there, and the people that followed that employee aren't there anymore. I think those are things that, again, are fair to have transparently communicated during the process and or even contracted so that there is real expectation management. This is part of the biggest challenge when you look at these things, because so much is driven by the financial exit piece. But you know, you're hitting it. I think you got to be upfront about communicating.
That's good. I don't want to be unfair to private equity, because, just full disclosure, my experience is very, very limited. The thing I wrestle with just thinking about private equity is just how baffling it is to me that private equity wouldn't want to preserve the people and the culture, knowing that the people and the culture are what ultimately drive profit. So if private equity is primarily about profit, which I understand, it's a business transaction, you're setting it up for future exits. It's a business transaction. I get it. It is for profit. I think that's good. What's crazy is the way to profit is people. And so more prioritization around people and culture would actually drive more profit, not coming in and torpedoing the culture or torpedoing the people and then going, well, wow, why is our profit not going up? So again, I don't want to pretend to be a private equity partner. Maybe some of those things are very, very unfair. But just seems to me that if private equity really wanted to maximize profit, they would actually maximize people first as a way of maximizing profit.
Look, Kate, for those listening, we didn't rehearse this. I think that's such a real point. It seems like everybody says people, process, technology. People are first. Why wouldn't you want to have our people focused? So I think this is probably one of the fairly basic filters between private equity A and private equity B. I want to paint the picture that there are many experienced sponsors that understand that concept very well. And I think you understand it when you've done this enough times and when you've seen the value of the team that's been there. I think, is it fair to say that sometimes the lens of the people that have run the practice for a year is a little bit jaded, and they don't maybe have the full picture on how much better an employee can be? I think that's fair. I think everybody would address that. But your concept of good people make good business, which is sort of what you're saying, I think many sponsors understand that. And they deliver that in terms of education and in terms of benefits to the employee. I think what's happened here lately, and I think this is a really important point, is the softer things. Look, we're going to have a company retreat. We're going to have an education program that you can get reimbursed for education. Those things have become even harder to do in light of the margin pressure. So you come out of COVID and you've got a 10 to 15 to 20% increase in staff costs because everybody had an option to go to work for Starbucks or to go to work for the healthcare institution. And you had to take your staff up $1.50. And then once you did that for one person, everybody got wind of that and everybody's all of a sudden 15 to 20% up. Remember that that margin pressure is hit on leases and staff and all the costs of supplies. The second part of this is, and we won't get too deep into it, but the mechanics of a bank loan. When the bank loan's 7% versus 2%, and you've got to service that debt, all of a sudden the pressure on margin is much greater. So when you talk about things like education reimbursement, better health benefits, more flexible PTO, everybody gets their uniform paid for versus you got to buy it yourself. These are classic things. When you're under margin pressure, those things are much more difficult to actually execute on. And therefore, you want somebody who understands the value of that and is able to leverage their size and scale as a sponsor to reduce some of those other costs so that you can maintain investments in the culture and the family piece that has gotten that practice from 20 years ago to where it is today. That resonate. I think these are important concepts that hit.
Yeah, it is a fascinating conversation, and things to think about. I guess a couple more questions for you before we wrap up. What do you think the future, and you kind of started our conversation about, wanting to get into this, so maybe this is the time, but what is the future of private equity in private practice healthcare? And going back to how you started, the pros and cons of that for healthcare itself.
Yeah, I mean, if you have 10 people on your podcast, everybody will give you their prediction. And I think some of it will be consistent, some of it will be sort of off the radar. I think what I hear from most sponsors lately is they really want to invest in an asset that is well run. Maybe if we think about it as historically, there was a lot of interest in what they call sort of stacking EBITDA. I've got practice A on top of practice B on top of practice C. They all make $1 million of EBITDA. Now I got 3 million. I can turn around and sell that for 10 million. It didn't matter as much how well it was run. In today's world, the scrutiny on operating efficiency has never been higher. Why? Well, part of it is the bank loan scenario, but part of it is the need to transact. And people aren't buying poorly run organizations anymore. So the interest is high in a very well-oiled machine. I think that's sort of where we are today. There is still a disconnect, however, in terms of what the physician or the current owners think the value of their practices versus what people are paying. I think that delta sort of probably spiked last year is coming down a little bit more, meaning people are starting to recognize, well, I'm probably not worth 18 times my profit line. Maybe I'm worth 10 times or 11 times. So I think there's getting to be a little bit more realism of the sellers, but I think that still exists, and so there's some brakes are being pumped a little bit. The next thing I'd say to you is you got to look at sort of the specialty and what's the maturity of the specialty. So things that are hot are med spa, things that are cash pay that aren't as connected to reimbursement and maybe don't have as much needle moved on the staff cost or the lease. I think there are still businesses like cardiology and behavioral health that are new and that there are still very well-run organizations that are being rolled up and being connected that are producing the right income. I think that there is an interest, but overall the interest is now really scrutinized by the quality of the asset. So not going away, probably focused on specialties that are less mature. Ultimately, you still have to have a really good asset to do this. And I think, this is not gone. This is just a different lens today than it was maybe 5 years ago.
That's good. All right. I guess before we wrap up, make a pitch for ModMed. So if you're a private practice and you're looking to transition, maybe you don't even have a practice management software, which I've been shocked at the number of people who don't, or at least have a good one. And so make a pitch for ModMed. What are your competitive advantages and what value do you bring to a private practice from a technology landscape?
I appreciate that opportunity, and let me start by telling you that I've got a long career of being in sales, but I'm not in sales anymore. And so I really view this as a intellectual exercise in what makes sense. I think if you take the last point I made, which is this idea of scrutiny for operating efficiency, which is where the world is. And frankly, it is the case whether you're thinking about a private equity sponsor or you are running your practice independently. Right. Costs are higher. You need to run a better practice. You need to have your handle on how patients get to you. You need to be able to measure and monitor things that are driving your profitability. I think our perspective is, the ModMed perspective is, that's where we play best, both in the EMR space and the practice management space. How does a technology tool actually help your margin pressure? Let me give you specific examples that I think we excel in. When you're coding as a physician and you make a mistake and you haven't caught that mistake, and you end up billing and the denial happens, you've now added all kinds of work and lack of efficiency to your process. But if your technology can help you code, not code for you, but help you do the right thing, get it through the system, get paid, you're helping the margin pressure that you're feeling. We think technology is really a tool to help be more efficient, to help maximize the staff and the team that you have. I think that's where ModMed excels. I mean, we were early in the cloud. People were talking cloud. We were already in it. And with that comes a great deal of structured data, of predictive analytics, of being able to say, we think you're going to do this, doctor. You've done this 10 times. We're going to recommend that we're going to put that in front and say, do this. So I think technology really is coming into its own today in the world of high margin pressure. The second thing and last thing I'd say, and it's less of a pitch, is we just talked about consolidation. This is what's happening. Whether it's hospital consolidation, private equity, it's Dr. Smith buying Dr. Jones. Like, this is the time for companies like ours to lean into enterprise structures. And you do that by really listening to your customer, being focused when you say yes on what that implementation looks like and not having this 6-month drop in revenue. I think ModMed has really recognized, and maybe I'm living proof, they put somebody in a role to sort of manage the private equity relationship, really recognize that as the enterprise grows, we grow. And so that attention, that focus, I think is unique for our company. We've been doing this for 12 or 15 years. And I think at this stage of the game, we've got enough credibility that says, we know what you need. We've listened to you. We've built it for you. I think that's probably the best approach that I have thinking about the business.
Excellent. Very good. Well, Jeff, thank you so much. If someone listening wants to connect with you and reach out, what's the best way for them to get into touch with you?
Yeah, Jeff.Friedman at modmed.com. You certainly go to the ModMed website. It is I think an excellent illustration and representation of what we do. Certainly interested in all questions follow up from this. This has been super fun, Kate. I applaud you for the forum.
Yeah, thank you. Yeah, it's been very interesting for me as well. So, Jeff, thank you so much. I've appreciated getting to learn from you, and thanks again for joining us.
Definitely, really enjoyed it. Thanks so much.